everybody, my name is Christine Santos, and today I'm going to be presenting complementary therapies for diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and it comes from the food that you eat. Insulin is a hormone that is made by the pancreas and helps glucose from your food get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. The three most common forms of diabetes are type 1, type 2, and gestational. Type 1 diabetes, the body does not make insulin. The immune system attacks and destroys the beta cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. In the United States, about 5% of people with diabetes have type 1. Genetics is the biggest determinant. In type 2 diabetes, the body doesn't make or use insulin well. Type 2 diabetes can develop at any age, even during childhood. However, this type of diabetes often occurs in middle-aged and older people. Type 2 is the most common type of diabetes, with 90 to 95% of diabetes cases are diagnosed as type 2. Gestational diabetes develops in some women while they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you've had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. Sometimes diabetes diagnosed during pregnancy is actually type 2. Every year, 2 to 10% of pregnancies in the United States are affected by gestational diabetes. There are other types of diabetes which are less common, which include monogenic diabetes, which is an inherited form of diabetes that results from mutations or changes in a single gene. In the United States, monogenic forms of diabetes account for 1 to 4% of all cases of diabetes. Cystic fibrosis-related diseases also occur in people with cystic fibrosis. The thick, sticky mucus that is a characteristic of the disease causes scarring of the pancreas. This scarring prevents the pancreas from producing normal amounts of insulin. So like people with type 1 diabetes, they become insulin deficient. Their pancreas will still make some insulin, but not enough to stay healthy and maintain good nutrition. Diabetes does have a big bill. The total cost of diabetes in the United States from 2017 was $327 billion, and this was for direct medical costs. There was a $90 billion loss in reduced productivity. For the rest of this presentation, we're going to be specifically focusing on type 2 diabetes, and again, this is when your body either resists the effects of insulin or it doesn't make enough. The first signs and symptoms are increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, areas of darkened skin, usually in the armpits and neck. And there are a few different tests for the diagnosis of type 2 diabetes. One of them is your A1C test, and this blood test indicates your average blood sugar level for the past 2 or 3 months. Normal levels are below 5.7%, and a result seen between 5.7 and 6.4% is considered prediabetes. An A1C level of 6.5% or higher on 2 separate tests means that you have diabetes. Regardless of when you last ate, a random blood sample showing that your blood sugar is 200 milligrams per deciliter or 11.1 millimoles per liter or higher suggests diabetes, especially if you have the signs and symptoms of diabetes as mentioned above. For a fasting test, a blood sample is taken after an overnight fast. A reading of less than 100 milligrams per deciliter or 5.6 millimoles per liter is normal. A level from 100 to 125 milligrams per deciliter or 5.6 to 9.9 millimoles per liter is considered prediabetes. If your fasting blood sugar is 126 milligrams per deciliter or 7 millimoles per liter or higher on 2 separate tests, you have diabetes. The current conventional treatment for diabetes includes weight loss, healthy diet, regular exercise, and possible medications or insulin, and generally blood sugar monitoring as well. Generally, metformin is the first prescribed medication for type 2 diabetes. It works by lowering glucose production in the liver and improving your body's sensitivity to insulin so that your body uses insulin more effectively. Some people who have type 2 diabetes need insulin therapy. In the past, insulin therapy was used as a last resort, but today it's often prescribed sooner because of its perceived benefits. As mentioned before, type 2 diabetes is the most common form of diabetes. 90 to 95% of diagnosed cases of diabetes are type 2. 3.3 million Americans, which is also 9.4% of the US population, have diabetes. Another 84.1 million have prediabetes, a condition that, if not treated, often leads to type 2 diabetes within 5 years. Some of the determinants of type 2 diabetes are lifestyle choices, gender, and race. Neighborhoods with low income have a higher prevalence of diabetes than wealthy neighborhoods. It has been speculated that the increase in diabetes risk seen in low-income groups is related to the increased prevalence of obesity within this group. Obesity remains a potent risk factor for the development of diabetes. However, low income has been shown to be an independent risk factor for the development of diabetes, even when controlling for body mass index and physical activity level. Additionally, type 2 diabetes is more common in males versus females. American Indians, non-Hispanic Blacks, and Hispanics have the highest rates of diagnosed diabetes. The lifetime medical cost for type 2 diabetes is $85,200. There is also a range between $4,369 to $4,671 in loss of productivity per year of type 2 diabetes. And now we're going to talk about the pathophysiology of diabetes. As we mentioned, insulin is a hormone that is produced in the pancreas by beta cells. The pancreas is below and behind the stomach. Insulin is needed to move blood sugar, which is glucose, into cells. The way this process works is insulin binds to insulin receptors on the cell. When insulin is bound to the transporters, glucose can easily enter the cell via the GLUT4 transporter. Inside the cells, glucose is stored and later used for energy, but it is sometimes used immediately. With type 2 diabetes, your adipose, liver, and muscle cells do not respond correctly to insulin. This process is called insulin resistance. As a result, blood sugar does not get into these cells and can be stored for energy. When sugar cannot enter the cells, a high level of sugar builds up in the blood. This is called hyperglycemia, and this is where those side effects start to happen. The body is unable to use glucose for energy. This leads to the symptoms of type 2 diabetes. Normal regulation of glucose metabolism is determined by the feedback loop in which tissue sensitivity to insulin determines the magnitude of the beta cell response. When insulin resistance is present, the beta cell maintains normal glucose tolerance by increasing insulin output. It is only when the beta cell is incapable of releasing sufficient insulin in the pancreas of insulin resistance that glucose levels rise. Insulin resistance will typically lead to type 2 diabetes. The first alternative therapy that we're going to talk about is fenugreek. Historically, fenugreek was used for a wide variety of ailments from digestive problems all the way to inducing childbirth. Today, fenugreek is used as a dietary supplement for diabetes to stimulate milk production during breastfeeding, and it is used topically for wounds or eczema. The seeds are made into capsules, powders, teas, liquid extracts, and dressings for the skin. For this study, a patented form of fenugreek seed extract was used to ensure consistency of dose. The patented form was called Fenfuro. This study was a randomized, placebo-controlled, double-blind clinical study. Fenfuro or a placebo was given in addition to standard anti-diabetic therapy to 154 male and female subjects with type 2 diabetes over a period of 3 months. Both the placebo and treatment groups consumed metformin as their anti-diabetic therapy, while the treatment group consumed Fenfuro in conjunction with metformin. Fenugreek seeds are known to contain soluble dietary fiber, protein, vitamin C, niacin, potassium, 4-hydroxyisoleucine, lysine, and L-tryptophan. Fenugreek seeds also have a gel-like soluble fiber that has been shown to combine with bile acids and lowers the triglyceride and LDL levels. The amino acids present are useful in boosting insulin sensitization and glycogen synthesis. Dietary fibers that are present are specifically known to enhance hypoglycemic activity. Additionally, dietary fiber may significantly contribute to fenugreek's activity in lowering blood glucose and cholesterol. For this study, Fenfuro treatment caused a significant decrease in fasting plasma sugar levels compared to the corresponding placebo-treated group. Approximately 6.69, 10.31, and 21.98 decreases in fasting plasma sugar levels were observed at 30, 60, and 90 days. There were no specific adverse events reported by the subjects, and the blood chemistry analysis in the placebo and treatment groups demonstrated the broad-spectrum safety of fenfuro in conjunction with metformin. The study did not report any safety concerns. The second study took place in India, which is considered the diabetes capital of the world with around 62 million reported cases. A total of 60 patients were enrolled in the study, which was divided into two groups containing 30 patients. Patients were randomized into two equal groups. The treatment received fenugreek seed soaked in hot water with 10 milligrams each day, along with their routine anti-diabetic medication 30 minutes before a meal, while patients in the other group continued to receive only their anti-diabetic medication. For this study, strict dietary and exercise controls were followed as per the guidelines of the American Diabetic Association protocols. This study discussed a similar physiology. Soluble fibers in fenugreek, including glucomannan fibers, delays intestinal absorption of ingested sugars, and alkaloids such as fenugresin and trigolinine have demonstrated to possess hypoglycemic action, and the amino acid 4-hydroxyisoleucine acts on the pancreas to release insulin. The results of this study show that there was significant reduction in fasting glucose by the 5th month and significant reduction in A1C by the 6th month. There were no reported side effects, and the limitation of the study is the relatively small sample size. This third study was a 3-year randomized control parallel study for the efficacy of fenugreek. This study was conducted with women and men aged 30 to 70 years with the criteria of pre-diabetes. 5 grams of fenugreek powder was given twice per day before meals, and the progression of type 2 diabetes was monitored at baseline and every 3 months for the 3-year study duration. This study suggests that the enhancement of serum insulin levels is due to insulin nootropic effects. This study shows that fenugreek has hypoglycemic effects due to the increasing levels of serum insulin, and it is suggested that the mode of action of the fenugreek may be caused by their contents of alkaloids. Fenugreek seeds contain a gel-like soluble fiber which combines with the bile acids and lowers triglyceride and LDL cholesterol levels. The results of this study showed lower rates of diabetes and better metabolic outcomes compared to the control group. The fenugreek group saw a significant reduction in fasting plasma glucose, postprandial plasma glucose, and LDL cholesterol, where serum insulin increased significantly. It was observed that the controls had 4.2 times higher chance of developing diabetes when compared to subjects in the fenugreek group. The outcome of diabetes in the fenugreek group was positively associated with serum insulin and negatively associated with insulin resistance. There were no adverse effects reported in this study. The bottom line of fenugreek is that it is primarily found to be effective when used in conjunction with traditional diabetes medications. It is not suggested to take fenugreek while pregnant because it may affect uterine contractions. Fenugreek may act like an estrogen in the body and may be unsafe for women with hormone-sensitive cancers. Side effects of fenugreek may include diarrhea, a maple-like smell to urine, problems producing breast milk, perspiration, and a worsening of asthma. The next therapy that we're going to explore is cinnamon, and this comes from the bark of the cinnamon tree. It has been used for a spice for centuries and has a long history in traditional medicine. It is used for gastrointestinal problems, loss of appetite, and diabetes. It is used in capsules, teas, and extracts. The first study was a triple-blind, placebo-controlled randomized clinical trial using a parallel design. 140 patients referred to the diabetes clinic of ZAD University of Medical Sciences were diagnosed with type 2 diabetes were randomly assigned to 4 groups. The 4 groups were a cinnamon group with a BMI of less than 27, a cinnamon group with a BMI above 27, a placebo group with a BMI of less than 27, and a placebo group with a BMI of above 27. Patients received cinnamon bark powder or placebo in 500 milligram capsules twice daily for 3 months. Anthropometric, glycemic, and lipid outcomes were measured before and after the intervention. It is reported that cinnamon extracts activate the insulin receptor kinase and inhibits the insulin receptor dysphosphorylation, which improves the insulin sensitivity. Cinnamon also showed to be able to inhibit glycogen synthase kinase 3, which leads to increased glucose uptake. For this study, cinnamon supplementation led to improvement of all anthropometric measurements, including BMI, body fat, and visceral fat. There were also improvements in glycemic and lipid tests as well. All observed changes were significantly more prominent in patients with higher baseline BMI of above 27. No patients reported any adverse effects in the cinnamon group. Only one patient reported allergic reaction, which led to withdrawal from the study intervention. The second study is a randomized, blinded, placebo-controlled trial with 60 volunteers. Participants were divided into 6 groups. The cinnamon groups are given 1, 3, or 6 grams per day, and the placebo group was given 1, 3, or 6 grams of wheat flour in the 500 milligram capsules to be taken immediately before meals. This study was conducted for 90 days. Procyanidin type A polymers have been shown to promote insulin receptor autophosphorylation, which increases insulin sensitivity. The results of this study showed that each dose of cinnamon provided statistically significant decreases in fasting serum and glucose levels after 40 days. The decreases ranged from 18 to 29%. Placebo serum glucose levels increased from 0.6% to 2.7% for the same duration. Cholesterol levels were also significantly affected in the cinnamon groups. This study reported some safety concerns. There is a potential for hypoglycemia when cinnamon is used in combination with anti-diabetic agents. Theoretically, there may also be an interaction with anticoagulants because of their coumarin component in cinnamon. The study reports that no such interactions or adverse events have been reported in the medical literature, so it is difficult to determine their clinical significance. Additionally, regular ingestion of larger doses, patients may need to worry about pesticide contamination. The third study is a double-blind, randomized, placebo-controlled clinical trial with 44 patients who have had type 2 diabetes for the last 8 years. Patients were aged 57 plus or minus 8 years. Participants were randomly assigned to take either 3 grams per day of a cinnamon supplement or a placebo for 8 weeks. Fasting blood glucose, insulin, and A1C levels were all taken at the beginning and at the end of the study. Previous animal and human studies found that cinnamon intake can improve insulin resistance and decrease blood glucose concentrations and A1C. After an 8-week intervention, changes in the level of fasting blood glucose, insulin, the study revealed that cinnamon supplementation had no significant effect on glycemic and inflammatory indicators in patients with type 2 diabetes. There were no safety concerns discussed. The limitations of the study are the relatively small sample size and short duration. The bottom line of cinnamon is that it was found to be somewhat effective in the improvement of glycemic controls. It may provide more benefit for patients with a higher BMI or an early diagnosis. There are some additional concerns that we should be aware of. Supplementation with cinnamon can cause hypoglycemia when used with traditional medications. Also, environmental pesticides may be present in large doses. Some individuals may also have an allergy. Additionally, cinnamon contains varying amounts of a chemical called coumarin, which might cause or worsen liver disease. In most cases, cinnamon doesn't have enough coumarin to make you sick. However, for some people, such as those with liver disease, taking a large amount of cinnamon may worsen their condition. Cinnamon should not be used in place of conventional medical care or to delay seeking your healthcare professional if you are having health problems. The final recommendations for both of these therapies is that neither supplement should or can replace conventional diabetes therapies and medications. If an individual does choose to take a conventional therapy, it must be discussed with their healthcare provider to avoid confusing side effects. There is a lack of regulation regarding supplements, and third-party testing is always preferred. Safety and purity is an ongoing concern with any supplement, and standardization is always preferred when possible. Here are my sources, and thank you for listening.